Hi, hello, welcome back. So today we will be seeing about organ or disease oriented panel, the code series 80047 to 80076 from the pathology CPG topic. Okay, so the we will be discussing all the topics under pathology. So this is the first part. First of all, you have to know what is called as organ or disease oriented panel. So it is a group of laboratory tests that are typically performed together to evaluate a specific organ system or to diagnose a particular disease. The CPT codes of these panels are combined multiple tests under a single code. Okay, so for coding this, the key points to remember are, first of all, the panel definition, that is each panel has a specific set. So each panel has a specific set of tests that must be performed. If any of the tests in the panel is not performed, you should code it as individual code. Okay, so common CPT codes for the panels are here. We will be giving some of the common examples which are used as a panels here. So one thing you have to keep in mind, we have basic metabolic panel, like that. We have certain panels. Okay, so under each panel, for example, if you take basic metabolic panel, the code is 80048. It includes all the tests, that is calcium, carbon dioxide, chloride, creatinine, glucose, potassium, sodium, urea, nitrogen. If any of the test is left out, you should not give basic metabolic panel code. Instead, you have to code each test individually. So in the next comprehensive metabolic panel 80053 also, it includes all the tests. If all the tests are performed only, you can give 80053. If any of the test is left out, you have to code each test individually. Okay, so that's all about panel thing. And lipid panel, the code is 80061. It includes all the tests, that is cholesterol, lipoprotein, triglyceride, all the tests are given. If everything is performed, then only you have to give 80061. So next we have to see the coding step. First of all, we have to identify the panel, and then we have to check for all the components whether all the tests are performed under this, and then we have to code the correct CPT code, and you have to go through the medical record carefully. So these are the tips for coding this organ or disease oriented panel correctly. And the other tips are, we have to be stay updated with the guidelines also. Okay, and then conclusion, by understanding the structure of the organ or disease oriented panel and following these steps, you can accurately code these panels in compliance with CPT guidelines. Proper documentation and verification of medical necessity are key to ensure the correct coding and reimbursement. That's all about organ or disease oriented panel. Thank you so much for watching this video. So keep on watching, then only you will be getting regular update about the pathology topics. Thank you so much for watching. Take care. Bye bye. If you haven't subscribed, please do subscribe.